Hi, I'm Dr. Erin Michos. I'm the Associate Director of Preventive Cardiology at Johns Hopkins University School of Medicine, and I'm really pleased to be here at the American College of Cardiology 2022 scientific sessions to talk about some of the trials that were presented in the lipid session of the late-breaking clinical trials. And there was 4 trials presented in this session. So first of all, about lipoprotein A, I'm really excited about this. So lipoprotein A is a riskier form of LDL cholesterol that's associated with early onset atherosclerotic cardiovascular disease and valvular calcification. And we really don't have effective therapies for it. There is one therapy that's pretty far along in development, Pelacarsen, that's an antisense oligonucleotide targeting lipoprotein A. But there's definitely more need for more therapies in this area. So in the Apollo trial presented by Dr. Steve Nissen, they looked at a new agent in a phase 1 study. This was a small interfering RNA, so a different mechanism. We've had experience with small interfering RNAs for targeting PCSK9 with the drug inclisiran. This is a small interfering RNA targeting lipoprotein A. And 32 healthy volunteers with elevated lipoprotein A were tested in this phase 1 trial, and it showed really at the 2 highest doses, there was a 96-98% reduction in lipoprotein A. So it works, it reduces lipoprotein A. It also had about a 20 to 25% reduction in LDL as well. It was generally safe and well tolerated. You know, there was some injection site reactions that we see with injectables that sort of resolved on their own. So I think that this was promising enough that this agent will be moving on to more advanced phase clinical trials. And I'm really excited about this because elevated lipoprotein A remains a wide unspread need. So another trial that presented was the PACMAN Acute MI trial. So we are familiar with Alirocumab. It's a PCSK9 inhibitor that has been shown to reduce LDL cholesterol substantially by 60%, and also has been shown to reduce major adverse cardiovascular events. And the previous outcome trial for this was the Odyssey outcome trial that enrolled patients that were a month to 12 months after an acute coronary event. But in this mechanism study, they actually enrolled patients with acute myocardial infarction, and within 24 hours of their acute MI, were initiated on Alirocumab versus placebo, and these patients underwent imaging with IVUS of their non-infarct related vessel, and they both at baseline and at 52 weeks, and showed that Alirocumab significantly reduced atheroma plaque, and showed plaque regression and stabilization. So I think this is really encouraging for several reasons. One, it helps kind of explain the clinical benefit that we see, but also confirms the safety of giving a PCSK9 in the hospital setting, in the setting of acute MI, that that it's safe to do that. You don't have to wait till a patient's stable and give it as an outpatient. And I think ultimately it'll improve adherence if we can start these medicines, up front in hospital. So that was exciting to see the plaque reduction for that. The third trial was the TRANSLATE-TIMI 70 trial. It was evaluating Vupanorsen, which is an antisense oligonucleotide that was targeting the ANGPTL3 protein enzyme. So ANGPTL3 is an enzyme that inhibits lipoprotein lipase and impairs triglyceride-rich lipoprotein metabolism. We already have a monoclonal antibody approved to target ANGPTL3, specifically in patients with homozygous FH. Because the mechanism is independent of the LDL receptor, so it can actually work in homozygous FH patients. So this agent is a different mechanism. It's an ASO, an angiotensin oligonucleotide targeting ANGPTL3, and they were looking at whether it could reduce non-HDL cholesterol. And it did work for that. It did reduce non-HDL cholesterol. It also reduced LDL and ApoB. So it was effective in that. Unfortunately, there was a significant increase in LFTs, liver function tests, and there was an increase in hepatic fat. And so because of that, I felt that the net benefit, it wasn't worth moving this drug onto further clinical testing. Nevertheless, I think it was an important trial because these ASOs, and specifically targeting the ANGPTL3, Protein is an emerging area of therapeutics, and I think that we've learned things from this trial that may affect future development. And then the fourth trial in this session was completely different than the others. It was really it was a grocery store intervention. It was partnering academic researchers with with commercial with Kruger, a grocery retailer. And it enrolled participants who had at least one cardiovascular risk factor, and there was three intervention groups. The control group got dietary advice in the grocery store, in Kruger's grocery store. This was counseling about the DASH-style diet. So the control group got one session with a dietitian in the grocery store aisles, and then there was increasingly ramp up where the group 2 got the more intensified dietary intervention, where they met more frequently with the dietitian. And the third group got even more intensive. So not only did they have the dietary advice, but they had additional training about using online technology, such as online food shopping, about how to make healthy choices. And what they showed in all of these three groups, adherence to a DASH-style diet was increased in a dose-response fashion, with those that getting the most information had the greater adherence to the DASH-style diet. They didn't see a change in blood pressure, but part of this occurring right before the COVID pandemic, and the individuals that were enrolled and participated before the COVID pandemic, it was nearly 100% attendance with the visits, which were held in the grocery store, showing that this is a model that could work. And even after the COVID pandemic, there was still a very good, pretty good adherence with coming to the visits. So I think this is a really novel way of how we can work and partner with society and with commercial and with food industry to help with our patients make healthier choices.